ensure healthy lives, and promote well-being for all at all ages.
This is the challenge issued by Sustainable Development Goal number 3.
But currently, the world is facing a global health crisis unlike any other. COVID-19 is spreading human suffering, destabilizing the global economy, and upending the lives of billions of people around the globe.
And worldwide, we are facing a huge shortage of accessible healthcare, and thus a lot of other health issues are being ignored as we face this current pandemic.
So, what can we do to help improve the health and well-being of billions of people?
And how are we so far in trying to achieve this globally and in the Philippines?
Hello, science fans!
My name is Chona, and I'm your resident Filipina scientist. Join us in this episode where we talk about Sustainable Development Goal 3, good health and well-being.
In 2018, an estimated 6.2 million children and adolescents under the age of 15 years died, mostly from preventable causes.
Of these deaths, 5.3 million happened within the first 5 years of life, and almost half during the first month.
Malnourished children, particularly those with severe acute malnutrition, have a higher risk of death from common childhood illnesses such as diarrhea, pneumonia, and dengue.
And nutrition-related factors contribute to about 45% of the causes of death to children below 5 years of age.
And our lack of preparedness for the COVID-19 pandemic is unsurprising, as over 40% of all countries have fewer than 10 medical doctors per 10,000 people.
And in the case of maternal health, over 55% of countries have less than 40 personnel in terms of nursing and midwifery per 10,000 people.
Every day in 2017, approximately 810 women died from preventable causes related to pregnancy and childbirth.
And reproductive health education plays a huge role in this problem, as young adolescents ages 10 to 14 face greater risks and challenges in child-rearing and childbirth compared to other women.
And in the Philippines, one of the leading causes of death were heart attacks and cardiovascular diseases, impacting around 120,800 people yearly.
And the other leading causes of death? Cancer, stroke, pneumonia, and diabetes.
A high consumption of meat can be linked to a high rate of heart disease.
And this is troubling because in a recent survey, it actually indicates that only 7% of Filipinos consume plant-based products regularly, and 16% actually admit to not consume any kind of plant-based products at all.
In order to address these issues, together with the fresh challenges brought about by the pandemic, the United Nations set up indicators that starts with the health of mothers and newborns.
For example, by 2030, we are challenged to reduce maternal mortality to less than 70 per 100,000 live births.
Currently, the world is at 211 deaths per 100,000 live births, and the Philippines is at 121 deaths per 100,000 live births, which means we have a long way to go.
We want to reduce neonatal mortality to as low as 12 deaths per 1,000 live births, and under 5 mortality to as low as 25 deaths per 1,000 births.
And so far, globally, the number of neonatal deaths declined from 5 million in 1990 to 2.4 million in 2019, and the total number of under 5 deaths worldwide has declined from 12.6 million in 1990 to 5.2 million in 2019.
By 2030, we also want to end the epidemics of AIDS, tuberculosis, malaria, and other neglected tropical diseases. We also want to combat hepatitis, waterborne diseases, and other communicable diseases.
And this would require more doctors and more scientists, improved healthcare access, and also new technology to vaccinate, treat, and cure individuals who suffer these diseases.
And by 2030, we want to reduce by at least a third premature deaths caused by mental health issues. through prevention, treatment, and promotion of good mental health and well-being.
And though a lot of progress has been made on this front, we still battle with mental health stigma in the Philippines as people downplay mental health issues by insisting on resilience, faith, and positive thinking to be easy alternatives to proper treatment.
The United Nations also emphasizes the need to strengthen the prevention and treatment of substance abuse, including narcotic drug abuse and the harmful use of alcohol.
And here we see the call to treat drug addiction as a disease, rather than a criminal behavior, and that more effective ways of solving this problem is through non-violent approaches.
Interestingly, SDG3 goes from the clinic to the streets by aiming to cut by half the number of deaths and injuries from road-related accidents.
And according to the latest World Health Organization data published in 2018, road traffic accident deaths in the Philippines reached 10,624, or 1.74% of total deaths, which ranks us at 118 in terms of countries with prevalent road traffic accidents.
And by 2030, we want to ensure universal access to reproductive health care services, from family planning to education.
The Philippine Congress enacted the Reproductive Health Law in 2012, but its implementation has been hampered by our largely conservative view on sex and reproductive health, which still led to the 180,916 recorded teenage pregnancies in the Philippines last 2018 alone.
And of course, a lot of our health issues would be limited if we were able to achieve universal health coverage.
The PhilHealth system was supposed to help with this, but with allegations of wide-scale corruption and issues on delayed release of funds, many are still hesitant to get checked in clinics and hospitals due to limited financial resources.
SDG3 is also linked with the environment, as by 2030, we're also supposed to reduce the number of deaths and illnesses related to air, land, and water pollution.
And while the Philippines enacted a law nearly 20 years ago to convert all open dump sites into sanitary landfills, government data shows that there are still 403 open dump sites and 108 controlled dump sites in the country.
Air pollution is also at an all-time high despite the pandemic, with air pollution in Metro Manila alone at 1.1 times higher than the approved World Health Organization standards.
We see a lot of efforts locally and globally despite the pandemic. But what can STEM do to help with SDG3 to achieve good health and well-being?
One of the key factors in good health is personalized medicine. And with the establishment of the Philippine Genome Center, we can hopefully start to understand Filipinos' diseases and our reactions to medicine in order to create better treatments for us.
STEM can also create innovations towards achieving a circular economy, so we can be more efficient in repurposing our waste and lead to the reduction of pollution.
Through STEM, we have been participating in the global stage, in the development of better diagnostic tools, treatments, and even vaccines for diseases like dengue and other neglected tropical diseases.
And through proper science communication, we can improve reproductive health education in the Philippines, lower cases of teenage pregnancy, and lower maternal mortality.
And so science has spoken, and science will continue to speak. And to achieve the Sustainable Development Goals, you must try and listen. But what do you think? What kinds of scientific innovations are needed in order to help achieve SDG3? How can the science community collaborate with other sectors of society in order to improve health and well-being? Let us know your thoughts and ideas in the comments section below.
And to keep updated with the latest videos from SHE-ensya, please follow us on Facebook and on Instagram. Follow me also on IG at shona.abeledo.
Thank you very much for joining us in the sustainability episode, and I hope to see you around.